Tetracycline.
Chapter 12 Tetracyclines. Chapter 12 Tetracyclines. Tetracycline are a group of natural and semi-synthetic antibiotics having nucleus of 4 cycle ring, hence the name in their structure. All are obtained from soil actinomycetes. Chlortetracycline was the first tetracycline to be obtained from Streptomyces aureofaciens in 1948 and was named so because the colony appear golden yellow. Broad spectrum antibiotics with similar antimicrobial feature, but they differ somewhat from one another in terms of their spectrum and pharmacokinetic disposition. Classes. There are 3 natural occurring tetracyclines: oxytetracycline, chlortetracycline, and dimethylchlortetracyclines. Several other that are derived semi-synthetically: tetracycline, doxytetracycline, methacycline, minocycline, doxycycline, etc. Elimination time permit a further classification into short-acting tetracycline, oxytetracycline, chlortetracycline, intermediate acting dimethylchlortetracyclines, and methacycline are long-acting deoxycyclines and minocyclines. Structure of tetracycline. General properties of tetracyclines. Tetracyclines are broad-spectrum antibiotics with similar antimicrobial features, but they differ somewhat from one another in terms of their spectra and pharmacokinetic disposition. All of the tetracycline derivatives are crystalline yellowish amphoteric substance that in aqueous solution form salt with both acid and bases. Tetracycline are characteristically fluorescent when exposed to ultraviolet light. The most common salt form is the hydrochloride, except for deoxycycline, which is available as deoxycycline halclate. The tetracycline are stable as dry powder but not in aqueous solution, particularly at higher pH range 7 to 8.5. Preparation of parenteral administration must be carefully formulated, often in propylene glycol or polyvinyl pyrrolidine with additional dispersing agent to provide stable solution. Tetracycline from poorly soluble chelation with bivalent and tetravalent cation, particularly calcium, magnesium, aluminum, and iron. Doxycycline and minocycline exhibit the greatest liposolubility and greater penetration of bacteria such as Staphylococcus aureus than does the group as a whole. Classification of tetracyclines based on source: natural tetracycline, oxytetracycline, chlortetracycline, and dimethylchlortetracycline. Semi-synthetic tetracycline, doxytetracycline, methacycline, minocycline, doxycycline, lemmacycline, etc. Based on duration of action or elimination. Short-acting tetracycline T-half 6 hours, tetracycline, oxytetracycline, chlortetracycline. Intermediate acting tetracyclines T-half 12 hours, dimethylchlortetracyclines and methacyclines. Long-acting tetracyclines T-half 18 hours, doxycyclines and minocyclines. Mode of action: the susceptible bacteria take up tetracycline by active transport. Since mammalian cells lack this active transport process, tetracyclines are selectively toxic to microorganisms. Because of the difference in ribosome of prokaryotes and eukaryotes, it has been possible to achieve some selective targeting of the protein synthesis process in the microorganism. The bacterial ribosome consists of 50S and 30S ribosomal subunit, and tetracycline bind to 30S subunit. The tRNA carries amino acid to the ribosome for protein synthesis. The ribosome has three binding sites, Y, A, P, and E site. Tetracycline bind to A site and prevent the binding of tRNA to this site. As a result, amino acid cannot be added to the growing peptide chain, thus they prevent protein synthesis. The tetracycline are generally bacteriostatic, and a responsive host defense system is essential for their successful use. At high concentration, as may be attained in urine, they become bactericidal because the organism seems to lose the functional integrity of the cytoplasmic membrane. Tetracyclines are more effective against multiply microorganisms and tend to be more active at a pH of 6 to 6.5. Doxycycline and minocycline have greatest lipid solubility and enter bacteria by passive diffusion, which make them more potent. The selective toxicity of tetracycline is mainly due to absence of carrier for active transport of tetracycline in the host cell and less sensitiveness of the host cell protein synthesizing apparatus. Tetracycline take up by active transport into bacteria, bind to 30S ribosomal subunit, complete with and prevent binding of tRNA to A site, inhibit protein synthesis. Bacteriostatic mechanism of a tetracycline. Bacterial resistance. Many organisms have now become resistant. The resistance is so widespread that the usefulness of this group of drugs is largely brought down. Resistance to tetracycline is transmitted by plasmid that contain the gene coding for resistance. Moreover, the organism may easily develop resistance to many other antibiotics because the genes that control resistance to tetracycline also influence the resistance to many other antibiotics. Resistance is exhibited as decreased uptake or efflux of the antibiotic from the bacterium, displacing tetracycline from the binding site. Example, the target ribosome, elaborating enzyme that inactivate tetracycline. Cross resistance among different tetracycline is also noted. Antimicrobial spectrum. Tetracycline are about equally active and typically have about the same broad spectrum, which comprises both aerobic and anaerobic gram-positive and gram-negative bacteria, Mycoplasma, Rickettsia, Chlamydia, and even some protozoa amoeba such as Babesia, Thaleria, Anoplasma, Coccidia, and Enteroamoeba, except Mycobacteria, fungi, and viruses. Strain of Pseudomonas aeruginosa, Proteus, Serratia, Klebsiella, and Conibacterium species frequently are resistant, as are many pathogenic E. coli isolated. Even though there is general cross resistance among tetracycline, doxycycline, and monocycline usually are more effective against Staphylococci. Pharmacokinetics. Absorption. Older tetracycline are incompletely absorbed from the gut. Food interferes with their absorption. Bioavailability of chlorotetracycline is 30%, and that of tetracycline, oxytetracycline, dimethylcycline, and methylcycline range between 60 and 70%. Doxycycline 95%, and minocycline is 100% absorbed, and food does not affect the absorption of these two agents. Tetracycline cleared calcium and other metals, which reduce their absorption. Hence, tetracycline should not be given with milk and milk products, iron preparation, zinc supplements, and antacid. Tetracycline undergo enterohepatic circulation because of which they remain in the body for a long time. Tetracycline like oxytetracycline and deoxycycline can be given intravenously, but they cause irritation and thrombophlebitis. IM injections are painful due to local irritation and should therefore be avoided. Tetracycline at therapeutic level should not be administered PO to ruminant. They are poorly absorbed and can substantially depress ruminal microfloral activity. In veterinary, special buffered tetracycline solution to avoid irritation can be administered IM and IV through chemical manipulation, especially choice of carrier and high magnesium content. The absorption of oxytetracycline from IM site may be delayed, which produce a long-acting effect. Tetracycline can cause tissue necrosis at injection site, in which residue may remain for several weeks. Tetracycline can also be absorbed from the uterus and ureter, although plasma level remain low. Distribution. Tetracycline distributed rapidly and extensively in the body, particularly after parenteral administration. They enter almost all tissue and body fluid. High concentrations are found in the kidney, liver, bile, lungs, spleen, and bone. Lower levels are found in serosal fluid, synovia, CSF, acetic fluid, prostatic fluid, and vitreous humor. The more lipid-soluble tetracycline, deoxycycline, and minocycline readily penetrate tissues such as the blood-brain barrier, and CSF levels reach 30% of the plasma concentration. They also are present in saliva and tears. Because tetracycline tend to chelate calcium ion, less so for doxycycline. They are deposited irreversibly in the growing bone and in dentin and enamel of unruptured teeth of young animal, or even the fetus if transplacental passage occurs. See especially clinical concern below. Drug bound in this fashion is pharmacological inactive. Because of this property have may serve as marker in developing bone or in proliferating bone tissue. Tetracycline are bound to plasma protein to varying degree. Example: oxytetracycline 30%, tetracycline 60%, doxycycline 90%. Biotransformation of the tetracycline seem to be limited in most domestic animals, and generally about 1/3 of a given dose is excreted unchanged. Rotitetracycline is metabolized to tetracycline. Doxycycline and minocycline may be more extensively biotransformed than other tetracycline, up to 40% of a given dose. Excretion. Tetracycline are excreted via the kidney, glomerular filtration, and the GI tract biliary elimination and directly. Generally, 50 to 80% of given dose is recoverable from the urine, although several factors may influence renal elimination, including age, route of administration, urine pH, glomerular filtration rate, renal disease, and the particular tetracycline used. Intestinal biliary elimination is always significant, commonly 10 to 20% even with parenteral administration. For doxycycline and its metabolite, this is the major route of excretion. Tetracycline are also eliminated in milk. Concentration peaks 6 hours after a parenteral dose, and trace are present up to 48 hours later. Level in milk usually attain 50 to 60% of plasma concentration and are often higher in mastitis milk. Pharmacokinetic value. The plasma half-life of tetracycline are 6 to 12 hours and even longer depending on age. Sour elimination in animals less than 1 month old. Disease and the tetracycline itself. In large animals, daily injection of standard doses usually are sufficient to maintain effective inhibitory concentration. Long-acting formulation of oxytetracycline, when injected IM, generally produce plasma concentration greater than 0.5 microgram per ml for 72 hours. Tetracycline usually are administered pure every 8 to 12 hours or every 12 to 24 hours for doxycycline and minocycline. Elimination, distribution and clearance of tetracycline. Elimination, distribution and clearance of tetracycline. Oxytetracycline dose, volume of distribution, clearance. Dogs, cow, 3-month-old, cattle, horse. Minocycline, dog. Therapeutic indication. Therapeutic indication. The tetracycline are used to treat both systemic and local infections. General organ infection include bronchopneumonia, bacterial enteritis, urinary tract infection, cholangitis, metritis, mastitis, proctitis, and pyodermatitis. Specific conditions include infectious keratoconjunctivitis in cattle, chlamydiosis, hot water anaplasmosis, actinomycosis, actinobacillosis, nocardiosis, especially minocycline, ehrlichiosis, especially doxycycline, erythrozoonosis, and hemobartonellosis. Minocycline and doxycycline are often effective to somewhat a lesser degree against resistant strain of Staphylococcus aureus. In addition to antimicrobial chemotherapy, the tetracycline are used for other purposes. As additive in animal feed, they serve as growth promoters. Because of the affinity of tetracycline for bone, teeth, and necrotic tissue, they can be used to delineate tumor by fluorescence. Dimethylchlorotetracycline has been used to inhibit the action of antidiuretic hormone in case of excessive water retention and to stretch flexor digital tendon in neonate falls. Dose rate of tetracycline. Dose rate of tetracycline. Dose rates of tetracycline. Tetracycline species dosage route frequency. Tetracycline cat dog. Oxytetracycline cat dog. Cattle sheep pig. Class 4 lamb piglet. Doxycycline dog. Side effect and toxicity. Side effect and toxicity. Because several diverse effects may result from the administration of the tetracycline, caution should be exercised. Superinfection. Superinfection by non-susceptible pathogens such as fungi, yeast, and resistant bacteria is always a possibility when broad-spectrum antibiotics are used. This may lead to GI disturbance after either PO or parenteral administration or to persistent infection when they are applied topically. Example in the ear, GIT, severe and even fetal diarrhea can occur in horses receiving tetracycline, especially if the animals are severely stressed or critically ill. Tetracycline are to be given with food to minimize this effect. High dose administered pure to ruminant seriously disrupt microfloral activity in the ruminor reticulum, eventually producing stasis. Elimination of the gut flora in monogastric animal reduces the synthesis and availability of the B vitamin and vitamin K from the large intestine. With prolonged therapy, vitamin supplementation is a useful precaution. Effect on teeth and bone. Effect on teeth and bone. Tetracycline chelates calcium in teeth and bone. They become incorporated into This structure inhibits calcification, example hypoplastic dental enamel, and causes yellowish then brownish discoloration. At extremely high concentration, the healing process in fractured bone is impaired. Effect on CV system. Effect on CV system. Rapid IV injection of a tetracycline can result in hypotension and sudden collapse. This appears to be related to the ability of the tetracycline to chelate ionized calcium, although a depressant effect by the propylene glycol carrier itself may also be involved. This effect can be avoided by slow infusion of the drug or by pre-treatment with IV calcium gluconate. The IV administration of undulated propylene glycol-based preparation lead to intravenous hemolysis, which result in hemoglobinuria and possible other reactions such as hypotension, ataxia, and CNS depression. Anti-anabolic effect. Anti-anabolic effect. Because tetracycline interfere with protein synthesis even in host cells and therefore tend to be catabolic, and increase in BU and can be expected. The combined use of glucocorticoid and tetracycline often lead to a significant weight loss, particularly in anorectic animals. Hepatotoxicity. Hepatotoxicity. Hepatotoxicity effect due to large dose of tetracycline have been reported in pregnant women and in other animals. The mortality rate is high. Renal toxicity. The tetracycline are also potential nephrotoxicity and are contraindicated except for doxycycline. In renal insufficiency, fetal renal failure has been reported in septicemic and endotoxemic cattle given high dosage of oxytetracycline. The administration of expired tetracycline product may lead to acute tubular nephrosis. Phototoxicity. Phototoxicity, swelling, necrosis, and yellow discoloration at the injection site almost inevitably are seen. Phototoxic dermatitis may be seen in human patients treated with the methyl tetracyclines and other analogs, but this reaction is rare in other animals. Hypersensitivity. Hypersensitivity reaction do occur. For example, cat may show a drug fever reaction, often accompanied by vomiting, diarrhea, depression, inappetence, and eosinophilia. The tetracycline can inhibit WBC, chemotoxics, and phagocytes when present in high concentration at site of infection. This clearly hinders normal host defense mechanism. The addition of glucocorticoid to the therapeutic regimen would impair immunocompetence even further. Interaction. The absorption of tetracycline from the GI tract is decreased by milk and milk products, less so for doxycycline and minocycline, antacid, choline, and iron preparation. Tetracycline gradually loses activity when diluted in infusion fluid and exposed to ultraviolet light. Vitamin of the B complex group, especially riboflavin, hasten this loss of activity in infusion fluid. Tetracycline also binds to the calcium ion in ringed solution. Methoxyfluorine anesthesia combined with tetracycline therapy may be nephrotoxic. Microsomal enzyme inducer such as phenobarbital and phenytoin shorten the plasma half-life of monocycline and doxycycline. Except for monocycline and doxycycline, the presence of food can substantially delay the absorption of tetracycline from the GI tract. The tetracycline are less active in alkaline urine, and urine acidification can increase their Antimicrobial efficacy, drug discard time, drug withdrawal and discard time. Regulatory requirement for withdrawal time for food, animal, and milk discard time vary among countries. These must be followed carefully to prevent food residue and consequent public health implications. Drug withdrawal and milk discard time of tetracycline. Tetracycline species withdrawal time. Oxytetracycline, cat, pig, poultry. Oxytetracycline, long-acting, not used in lactating dairy cow, cattle. Chlorotetracycline, cattle, pig. Thank you.